is the part 2 of introduction to fixed partial denture, and in this video we will talk about what is the 3-unit FPD, what are the parts of fixed partial denture, and the classification of bridges, as there are different types of bridges. Okay, and the other one we will talk about indication and contraindication of fixed partial denture. So let's get started. So first, this is a bridge you can see, and it is also called the 3-unit FPD. So what are the parts of 3-unit FPD? First we will talk about is the crown. So it is a pontic, not a crown but an artificial crown, you can say. So pontic is a part of FPD which replaces the missing natural tooth. The other one is retainer. So retainer is a part of FPD. Retainer is a component of FPD which takes support from the abutment tooth and provides retention to the prosthesis. So connector, it is a part of FPD which connects the retainer and pontic together. The other one is the abutment. So abutment is a part of natural tooth, root or implant that serves to support and retain the bridge at one or both terminals. So remember, abutment is not a part of fixed partial denture. It is not part of prosthesis. It is a part of natural tooth, okay, that serves to support and retain the bridge. Now we'll talk about the classification of bridges. So these are fixed, fixed supported, fixed free, spring cantilever, removable, and adhesive. So the upcoming video we will talk about all of these types in detail. The materials we can use for the fabrication of fixed partial denture are gold, like metal. We can also use stainless steel fused to metal, porcelain, titanium, fiber reinforced composite, and acrylic. So these all materials we can use. Now who need this fixed prosthodontic treatment, or to whom we can provide these prostheses? Like if the patient has good oral hygiene and there is no infection, and the abutment which provides support to the fixed partial denture should be strong, and there should not be any temporomandibular disorder, and there should be harmonious occlusion, and patient compliance is very important. If the patient is willing for this type of prosthesis, you should go for it. And the cost is another factor which is very important, because it is a prosthesis which is expensive. If the patient can afford it, then you must go for it. Talk about what are the contraindications. So lack of support. This means the abutment is not strong enough to provide support to the fixed partial denture. The other one is presence of periodontal disease. In case of periodontal disease, you can see there are other conditions involved, maybe like if there is bone resorption of the abutment. In this case the patient's abutment tooth is not strong, and if the gums are swollen, then we cannot provide in this condition. Okay, the other one is mobility. So mobility may be present because of the bone loss of the abutment teeth. Surrounding bone may be lost. So first treat the disease and refer the patient. In case of infection, we should first treat the infection and refer the patient. In case of temporomandibular disorder, it's also contraindication, and parafunctional habits and bad oral hygiene. Cost, if the patient cannot afford, and the other one is patient interest. If the patient is not willing, then we can't provide the patient fixed partial denture. Thank you for watching this video. If you like, share, subscribe, and comment.